our effort to vaccinate adolescents. 50% of 12 to 17-year-olds now have at least their first shot. 50% of adolescents, this is critical progress as millions of kids head back to school. And in fact, the vaccination rate among adolescents is growing faster than any other age group.
I just want to let you guys know really quick, they have no idea what the hell they're doing. Their screen is on, but it's all black and messed up. This is all on their end.
She will discuss these vaccines are safe and effective.
They just cut their audio off. They just started mid-sentence. These people work for the White House.
Progress in vaccinations across the board, including through vaccination requirements. The president has adopted vaccination requirements for federal workers, the armed forces, the VA, and HHS healthcare personnel, and also nursing homes participating in the Medicare and Medicaid program will now be required to have their staffs vaccinated. This week, the president reiterated his call for public and private sector leaders to follow his lead on vaccination mandates and seeing continued momentum for stronger vaccination requirements across the country. Just since Monday, more employers are stepping up, including Disney, Deloitte, and the city of Chicago. The Business Roundtable, which represents more than 200 businesses that employ a total of 20 million workers, endorsed COVID-19 vaccination requirements, and they are encouraging state and local policymakers to, quote, support, not impede companies' ability to adopt these requirements. And just this week, nearly 50 colleges and universities, including the Ohio State University, one of the largest in the country, announced students, faculty, and staff will need to be fully vaccinated. And at Louisiana State University, LSU, to attend a football game this fall, you'll need to be vaccinated or show proof of a negative test. Overall, 800 colleges and universities, more than 200 healthcare employers, large and small businesses across the country, and many state and local governments have all adopted vaccination requirements to protect students, healthcare personnel, patients, employees, and consumers. Together, these vaccination requirements add up to make a big difference, helping protect tens of millions of Americans at work, at school, in healthcare settings, and at sporting events. This is the power of Americans coming together, all of us doing our part to protect not just ourselves, but our families and friends, our neighbors and colleagues, our communities, and our country. We can't and we won't let up, and we need everyone to get the job done. So if you're an American who is not yet vaccinated, or if you're an employer who is yet to adopt vaccination requirements, we have a very simple message. Get off the sidelines, step up, and do your part. Individuals get vaccinated. Employers adopt vaccination requirements. You have the power to protect your communities and help end the pandemic. With that, let me turn it over to Dr. Walensky. Dr. Walensky.
Thank you, Jeff. Good morning, everyone. We'll begin with an overview of the data. Yesterday, CDC reported nearly 165,000 new cases of COVID-19. Our 7-day average is at about 142,000 cases per day. This represents an increase of nearly 3% from the prior 7-day average. The 7-day average of hospital admissions is about 12,000 per day, an increase of about 6% from the previous 7-day period. And the 7-day average of daily deaths has also increased to 864 per day, an increase of nearly 11% from the previous 7-day period. Today, I want to talk about children. As a mother of 3, I know how important it is for us to protect our kids and give them every opportunity to succeed. And this is why it is so important for us to get our children safely back in the classroom for in-person learning. While symptomatic and severe cases in children remain less common than in other age groups, we have seen increases in pediatric cases and hospitalizations over the last few weeks, which is likely the result of overall increases in community transmission generally, and more specifically, the Delta variant's increased transmissibility. It's human nature to protect our children above all else. And the best way to protect them is to get everyone who is eligible vaccinated and surround children who are not yet vaccine eligible with people who are vaccinated to effectively shield them from COVID harm. We also have clear, scientifically backed guidance that offers a framework for schools to open and remain open for a safe and healthy learning environment in this unprecedented academic year ahead. Evidence has repeatedly demonstrated that multi-layer prevention strategies, such as vaccination for all children and adults who are eligible, masks for all students, teachers, staff, and visitors, ventilation, cohorting, physical distancing, and screening testing, work to prevent the spread of COVID in schools. Schools should implement as many of these prevention layers as possible simultaneously. And this serves to protect our children, even if there are inevitable breaches in any single protection layer. Adding to this body of evidence, 2 studies will be published in today's MMWR that demonstrate the importance of consistent and correct use of these mitigation strategies, especially vaccination and universal masking. In the first report looking at COVID cases in Los Angeles County, we saw the power of layered prevention. School-associated cases remained lower than cases in the community because of prevention efforts. In schools with safety protocols in place, case rates in children and adolescents were about 3.5 times lower during the winter peak compared to rates in the community. Even when communities were experiencing high levels of COVID transmission, in the LA County study, layered prevention measures in schools provided a shield of protection, helped to keep COVID out of school and reduce the spread when cases did occur. In a second report that closely studied an outbreak in a school in Northern California, we saw the absence of optimal multi-layered prevention can result in spread of COVID in this classroom and beyond. The introduction of the virus into the classroom by a teacher who worked in school while she was both symptomatic and unvaccinated, and who was unmasked when reading aloud to the class, resulted in cases within the classroom, across the school, and among families of students and staff in the community. We know how to protect our kids in school. We have the tools. This week, CDC released toolkits to help schools plan for and implement screening testing, and for parents to understand what they should be asking of, indeed expecting of their school systems to keep their children safe. Unfortunately, many schools have opted not to implement these recommended tools. We recognize and are closely following cases and hospitalizations in children at the same time as school reopening. In our outbreak investigations, large-scale quarantines or large number of cases are generally occurring in schools because schools are not following our guidance, particularly our recommendations for teacher as well as students aged 12 and over to be vaccinated, and for everyone right now to be masked. I want to strongly appeal to those districts who have not implemented prevention strategies and encourage them to do the right thing to protect the children under their care. We know these multi-layered mitigation strategies work, and thanks to the American Rescue Plan, schools have the resources to implement these strategies. Universal masks in schools work to prevent outbreaks and reduce the risk of children bringing the virus home to others who are vulnerable. This is not forever, this is for now. Good ventilation reduces the number of virus particles in the air and helps prevent transmission. This is not only true for COVID-19, but for all other respiratory viruses that will inevitably circulate throughout the school year. Vaccines work to prevent serious illness, hospitalization, and death. And when our children who are not yet eligible to be vaccinated are surrounded by vaccinated people, they are more protected. And school testing gives communities, schools, and families added reassurance that schools can open and remain open safely by swiftly identifying and isolating cases to effectively limit spread. We know what works. Now let us unify together to follow these steps to ensure fundamentally that our children and our future are safe. Thank you. I will now turn things over to Dr. Fauci.
Thank you so much, John Vickers, for joining the membership program, and welcome to the family.
Today,
you're officially a hooligan.
Vaccine efficacy and safety in adolescents. So let's first look at the efficacy of the mRNA vaccines in adolescents. As you could see, these two New England Journal of Medicine papers, on the left, the one from BioNTech, Pfizer, and the one on the right from Moderna. Note that both of these have essentially a 100% vaccine efficacy against clinically recognizable disease. So these vaccines are highly efficacious in this population of adolescents. Next slide. If you look at where we stand now with regard to the Pfizer-BioNTech for adolescents vis-a-vis authorizations and regulation, as you know, just to recall, the FDA issued an emergency use authorization for use in persons equal to or older than 16 years of age on December of 2020, on the 11th. An EUA was expanded to include adolescents aged 12 to 15 years old on May 10th of this year, which was based on results from a phase 3 clinical trial. And the vaccine was fully licensed by the FDA for persons aged equal to or older than 16 just in August 23rd of this year, just a few days ago. Vaccine continues to be available under an EUA for younger individuals, namely adolescents 12 to 15 years of age. Next slide. So what about Moderna? Moderna requested an EUA for their mRNA 1273 vaccine for adolescents 12 to 17 a couple of months ago in June 10th of 2021, and that FDA decision is pending. What about safety? Next slide. Safety in these vaccines in adolescents, the expected mild, local, and systemic reactions, which are common among adolescents, similar very much to adults. There are serious adverse events, but they indeed are rare. Next slide. Myocarditis. And in every instance and every analysis, the risk-benefit ratio, given the risk of myocarditis and other aspects of disease with COVID-19 versus the risk of vaccination, in all determinations, the benefit has always very much outweighed the risk. Last slide. And so what are the reasons for adolescents to be vaccinated against COVID-19? First, we know the vaccines are safe, effective, convenient, and free. The next is to obviously protect yourself from COVID-19, but also to help protect family members, friends, classmates, teachers, and other important people in the lives of the adolescent. Some of them actually may be especially vulnerable to COVID-19 complications, and you might not know that they are vulnerable. So therefore, there's so many, many reasons for adolescents to be vaccinated. I'll turn back to you now, Jeff.
Thanks, Dr. Fauci and Walensky. Let's go ahead and open it up for a few questions. Kevin?
Thanks, Jeff. First question, let's go to Brenda Goodman at WebMD.
Thank you. Can you hear me?
Yes.
You're a little quiet, Brenda.
Okay. Dr. Walensky, I was glad to see that you wanted to talk about children, and I haven't seen the MMWR studies that you mentioned, but it sounded like those were conducted over the winter. Is that correct?
Actually, no, one of them reaches out through June. And in fact, it's the LA County, the Northern California one that speaks to the outbreak in the school. And my understanding is that was with the Delta variant.
Well, COVID cases in kids have increased fourfold in the past month. The Children's Hospital Association sent a letter to President Biden yesterday saying that they are worried about running out of beds. And you have repeatedly said schools can reopen safely if they follow the layered prevention strategies outlined by the CDC. But yesterday in his podcast, Dr. Michael Osterholm said these guidelines have done a disservice to schools and parents. He said they are largely based on studies done with previous and less transmissible versions of the virus and no longer apply under Delta. He said, who in their right mind believes that an aerosol is only going to be transmitted 3 feet and that plexiglass will make a difference? That's just wrong to continue to promote that. And the CDC guidelines do that unless educators have become convinced that they can reopen their schools safely. We have misled them. In light of the recent large increase in pediatric cases and the amount of transmission we're already seeing in schools, do these guidelines need an update? Do you stand by the idea that schools can be open safely if they follow them?
Thank you for that question, Brenda. We have seen outbreaks in schools that are occurring now in the context of not following these layered prevention strategies. These layered prevention strategies include not only vaccinating everyone who's eligible for vaccination, not only masking, cohorting, ventilation strategies, screening strategies, hand hygiene, the whole layered mitigation. And where we have seen these layered mitigations properly employed, we have also seen that cases really are reflective of what's happening in high community transmission. But we have also seen that the cases are not propagated in the schools. And in fact, that schools tend to be safer places for our children than the communities in terms of COVID spread.
Next question.
Liz Sabo at Kaiser Health News.
I don't think we're hearing Liz.
No. All right, next question. Let's go to Tom and Christopher.
Oh, hi, it's Liz.
Hey, Liz. Okay.
Hi, sorry about that. I had a question on the number of vaccinations. Do we have any idea if these are first-time vaccinations or if these are people coming in for the worried well coming in for a third dose?
The 1.1 million that was reported today, there were about 500,000 of people coming in for their first dose. And as I said, that's really important and part of a real acceleration of first doses that we've seen across the last several weeks, and very encouraging. Immunocompromised are eligible for a third dose, and we're seeing some increase there as planned. But the vast majority of the doses are first doses, and then people coming to complete their first dose 3 to 4 to 5 weeks later per the plan. So the vast majority of the doses are made up of first and second doses, but we are seeing some doses for those who are qualified for their third dose as they're immunocompromised. Next question.
All right, Tom and Christopher.
Hello. Yes. Thank you for the briefing. My question is sort of a 1.5 part question, really. The first half question being, I'm assuming that you still haven't received any guidance from the Justice Department on whether or not the federal government has the authority to institute a national mask mandate, but you can correct me if I'm wrong about that. And so my question is, for each one of you, just to be clear, if you had your druthers, would you prefer that every American be covered in some way by some sort of a vaccine mandate, be it local, state, employer, et cetera?
So we have no plans or authority for I think what you called a national mask mandate. The president has taken significant action on vaccination requirements across the federal government, across the military, across health providers that are at the Department of Health and Human Services and at the VA, and then also use the power of the government as payer through CMS, which is Medicare and Medicaid, to require vaccinations for nursing home workers, in that the data is clear that when nursing home workers have a lower level of vaccination, that residents get infected and suffer the consequences of COVID at a higher rate. And the president will continue to look for every lever he can pull on vaccination requirements. And we're all very heartened by the fact that private sector, public sector, schools are following suit with vaccination requirements. Next question.
All right, and a reminder, keep your question to one question. Dan Vergano, BuzzFeed.
Thanks very much, Dean Vergano, BuzzFeed. For Dr. Walensky or Dr. Fauci, we're wondering if you have a view on the hospitalization rate among children diagnosed with COVID-19. We're relying on AAP suggesting it's about a 1% rate for children diagnosed with COVID-19 resulting in hospitalization, but some hospitals are telling us they're seeing much higher rates, like around 15%. And so I'm wondering if you could offer some perspective on what you see as the rate. Thanks very much.
Dr. Walensky?
Sure. What we're seeing here is increasing in cases across the country and therefore increasing cases in hospitalizations of all age demographics. They tend to be consistent in terms of across the age demographics, meaning that the rates of hospitalization are actually higher among older age demographics than they are in the pediatric age demographic. But because the absolute number of cases is so high, the absolute number of children who are coming into the hospital is high. It's also the case that we are currently within a surge of RSV cases as well, respiratory syncytial virus cases. Many of the hospitalizations that are accumulating in pediatric hospital beds are infected with RSV. We're seeing RSV rates similar to what we generally see in the winter months. So that is actually also contributing to the pediatric hospital bed crunch.
Next question.
Last question. Let's go to Josh Wingrove at Bloomberg.
Hi, sorry, just to follow up on a couple of them. Are you reviewing the school guidance in light of Delta? Will it be updated, or is the guidance as exists now the guidance that will exist for the school year, or at least the start of it? And is the hospitalization rate higher than what we understand it to be? Do you have data on that? You said it's rising just because all cases are rising, but do you have numbers on that?
We are not looking at updating our school guidance right now. I can tell you that most of the places where we're seeing surges and outbreaks are in places that are not implementing our current guidance. The hospitalization rates that we're seeing with children right now are similar to prior surges. It's the absolute number of cases that we are seeing is increasing.
Well, thank you, everybody. We'll look forward to returning to our normal format next week, and I hope everybody has a good weekend. Thank you.
These people are so full of shit. Just a moment. I want to actually show you guys some slides of my own. So other information that they keep collaborating with the CDC on, it's also the information. So basically the National Institute of Health is who provided information to the FDA to get the FDA to push through the approval. I have to word everything very carefully. So hopefully you're still with me on this. So this is the National the National Institutes of Health. This is their website. This is where, if you Google it, this is where you'll end up. This logo, the logo you see in the top left corner, is on the bottom of all of Fauci's slides. This is the senior investigator of this group. This is from their website. This is not. I always forget you guys can't see my mouse. Anyways, I just refreshed the page. This is not like a Fauci slide. This is their actual website. You can look it up. You can see the code at the top. You can see this for yourself. This person can be Googled. They are a public icon or whatever. And if you look right here on the right side where it says about, and then it says born, and then it says spouse, the spouse is Anthony Fauci. So this person is married to Fauci. They investigate the information, basically meaning they make up their own numbers. Then they provide it to the FDA to get approval. That's her spouse. For anybody that didn't know how this is working, that's how it works. This is probably gonna get my video taken down, but you should go investigate it for yourself. It's trash. Like we already know that these people are lying to us, and they sit here and play these games with us. This is how all the, like, anybody that's ever had to go to court, you may have noticed, especially if you had to go more than once, your attorney, if your attorney is local, they know the prosecutors very well. And although when you're sitting in court, you sit there and, play good guy, bad guy, in reality, your attorney goes and plays golf with the prosecutor who's trying to send you to jail. They're buddies. They make phone calls and stuff. They hang out together, right? It's like that in every local, city, anything bigger in a village. Because if you live in a village, you don't have a courthouse. But anything bigger than that, these guys all hang out. They're all local government. That's how these assholes work. All these people in the White House and stuff, they're all buddies. They're all related somehow. They're trying to fool us. Now, if you're scared, you go do whatever you need to do so you don't feel scared. More power to you. But they need to stop telling us what we're going to do. That's bullshit. I want to sit here and numbers. We did this on the last live. They were like, well, you're 25 more times likely to have a hospital visit or kick the bucket. Well, what's 99.97% times 25? I think we came out to like 0.87 or something like that. You have a 0.87 chance of going to the hospital or kicking the bucket if you were to get the flu. You have a higher chance of dying running to the gas station in your car. You have a higher chance of falling out of the sky in an airplane. You have a higher chance of being struck by lightning. It's stupid. Do not let these people lie to you. And for people who are having issues dealing with family members and stuff, if they're even willing to have a conversation with you at this point, show this to them. I mean, I'm not bullshitting you. I haven't this whole time. You can look this up for yourself. These people are ridiculous, trying to pull the wool over our eyes. It's trash panda, and I just wanted to show you guys that. I know there's a lot of videos and stuff like on TikTok and stuff, and they're always doing conspiracy theories, but I actually looked into this when a friend had showed me, and I just thought I would show you guys. Most of you probably already know this, but to go through the steps in the way that I just did, maybe you can open someone's eyes to what's really going on around here. Anyways, let me flip the camera. All right. Well, big shout out to Lincoln Kane. Thank you so much for your donation and your support. I really appreciate you. I just noticed on Rumble they get a super chat now, so that's pretty cool. I was wondering if they were going to do it. Someone had mentioned it, so it looks like Rumble's actually moving forward with things. There's nobody on Odyssey, and I don't think there was anybody on Odyssey yesterday, so that's kind of weird. I don't know what's going on with that. Yeah, it's a conspiracy fact. I've been saying that to people for like a year. Not all conspiracies are just theories. Like, people need to realize that. And what's that meme that's going around? We need more conspiracy theories because all the ones we have are coming true. Real talk. Honky Kong. I am planning on doing a flag march. I don't think I can do it next week. I have stuff going on every other week. So what I'm going to try and do, if I can't do it once every other week, I should be able to do it once every other week. But because I can't do it every week, I kind of want to do it twice every other week. Like once at the beginning of the week and once at the end of the week. Tuesday was fine last week, or this last Tuesday. So I think if I can continue that on, it would be like a Tuesday and then another one on Saturday. That's just my goals at this point. I don't know if I can get that arranged, but I want to do it regularly. That's the goal. American 007, thoughts on it only spreading in schools not following the guidelines. They're ridiculous. I don't even want to call it a meme because it's actually just a really good show of how it works. Basically, if you don't get the jab, or you don't get the jab and you do get the jab, you can still get sick. If you don't get the jab and you do get the jab, you can still spread it. If you don't get the jab and you do get the jab, you can still kick the bucket. But if you don't get the jab, you can't die from the jab. And that's really what it comes down to. And so you don't really, I mean, unless you live in like communist California or New York, where you have to actually show your little piece of paper to go in and eat at a restaurant or go into a movie theater or anything like that, obviously having that little piece of paper is going to affect your life in public. Outside of that, there's no difference, except for the fact that if you get it, you can die from it. That's the only difference. And I don't understand. It's so ridiculous to hear these idiots at the White House, you know, say this, that, and the other. But they're contradicting themselves. They're like, oh, you need to go get it so we can end the pandemic. We can stop the plague. But they've already said it doesn't stop the plague. You could still die. You're still going to spread it. Like, you're still susceptible to visits to the hospital. And then the new variant, they're like, oh, well, it's a lot like having summer allergies. Well, we've been dealing with that forever. That doesn't sound that bad. The original version was a 99.97 chance of making you kick the bucket. It's dumb. It's dumb. These are their stats. These aren't like me going to research or me trying to convince you anything. You can go watch them all say this stuff. They're like, oh, wear a mask. You'll save everyone. Oh, wear 2 masks. You'll save everyone. Oh, go get the jab. You'll save everyone. Oh, if you get the jab, you can still spread it to everyone. Well, then why worry about it? Why worry about it? Because the people on the TV are telling you to. Because some people can't go to school if you don't. Because you can't go into a movie theater if you don't. These are not like biological reasons to go get it. These are communist reasons to go get it. That's the difference. That's the difference, is you're being restricted based on whether or not you do what you're told. It's not about your health. It's not about the greater good. Like, it's so dumb. It's so dumb. That's why they get so mad. That's why everybody in the little comment boxes underneath these kind of reports are so mad. Oh, I just wish everybody would bend over and take it. Why? Because you did? It's because you wore a red shirt today don't mean I got to wear a red shirt, but you're not going to let me eat at your restaurant if I don't wear a red shirt? That's discrimination, you trash bag. That's like saying you can't eat here if you're in a wheelchair. You have to be able to walk if you're gonna eat here. That's discrimination. Everybody's like, oh, you're killing people. What do you mean? You spread it just like the people who don't get the jab. You get sick. You can die. And they're like, oh, well, you have a better chance of surviving, a better chance of not going to the hospital than 0.03? You have better than a 0.03 chance? I'll risk it. Tell you what, I'll risk it. I have a higher chance of my monitor blowing up in my face right now. Like, I'll risk it. It's so stupid. I mean, you're free to do whatever you want. I'm not trying to tell you what to do. I'm more or less putting this information out there. Look it up. You don't have to take my word for it. You can look it up. These videos of these idiots since the beginning, you can just follow it. I mean, everybody forgot the emails were released. The same person telling you to do this, the same person telling you that the schools who don't follow what they're told are the reason that everybody's, kicking the bucket. This person was originally writing emails about how it doesn't, like, you're not going to die from this. That masks aren't going to save you. He was doing interviews and stuff saying masks are not going to save you. When Trump said, hey, we got this worked out. We got the jab available for everyone because everyone started wearing masks. If you get the jab, you shouldn't have to wear masks anymore. That's what I'm being told. Well, then all these Democrats and stuff went on TV and go, oh, I'm not getting the jab. I can't trust a jab that's experimental and it only took them 8 months to come out with and yada, yada, yada. And now look at them. You do what you're told or else. Well, I didn't know this was Cuba. I didn't know this was Nazi Germany. I didn't know that's where this was. Because it wasn't when I was born. I mean, it wasn't 2 years ago. So do with that information what you will. But you can look this up yourself. It's not bullshit. These are not slides. That is live Google. You can't see my mouse because the way I have everything set up. But I did refresh the page and stuff. And you can look it up yourself. Fauci and his wife and all these people connected to him, they run all these companies that collaborate and come out with FDA approval. It is very true. You can go look it up. It's trash. It's trash. And MD Krebs, that's fine. If you got the jab, then good. And there's a lot of people near me and who know me and stuff who went and got it, and that's fine. I'm just saying that what they are saying is not true. It's not. You can look it up. Like, it's... These people are liars. They're liars. And that's just all there is to it. I know there's older people out there that want to get it because, you know, they're worried or they have health complications, and that's fine. That makes sense for them. But for all of us that are younger and don't have health complications or children, nah, I'm going to risk it. I'm not concerned. Not with 0.03. You need a higher percentage than that. How many of you ever heard about the C22? C22 is the new one. If you get bored today, you go look that up. That's the new one that's coming out. I've already seen a couple reports of that. So, oh no, the new C22 version. Whatever. It's like the new Xbox came out. Anyways, if I say any more, I'm going to get my channel banned. I'm probably already at that point. Who knows? We'll know in a day or two if they kick my channel. Just could not hold that back. These people are terrible human beings. Traitors to the country. Anyways, thank you guys so much for being here. I really appreciate all of you. Please subscribe or follow on whatever platform you are currently watching right now. We go live every single day. There's supposed to be a press briefing with Jen Balsaki. I think in an hour and 15 minutes we will most likely be covering that. Big shout out to everyone who made donations, joined the membership program, or purchased any merch. I really appreciate all of you. You guys are what's keeping the channel going, and you're why I'm able to do this every day. So thank you guys so much. Make sure you join the Discord. No, Adam, I'm not going to delete the video. People need to be able to see this stuff. I know everybody keeps telling me, oh, Salty Cracker goes live and he deletes the video. Well, people can't watch it if I delete it. And not everybody can make it here when I go live. So I jump through all these hoops. I do all the censoring of the pews. I change every word I say. I guess I had somebody high road me the other day. They were like, oh, pews. Oh, the Fauci ouchie. Listen to how this guy talks. He's belittling all of you. No, you idiot. You have no idea how real the censorship is. I jump through all these hoops so people are able to watch this stuff after we are no longer live, because that's what it's about. The whole reason I even deal with YouTube's crap is so I can get the information to where the people are. The people are on the communist platform of YouTube, because YouTube comes built into every single phone sold in America. It's just the way it is. So I go through the hoops so we can all learn what's really going on. That's not, being condescending to you or being, down on you or anything, but it's a lot of work. It sucks, but it works. Look at how many of us show up every day. Look at how many people are in the Discord every day. Look at how up front in the front lines of information we all are. We all know what's going on. They can't say anything to us. We all know what's happening. We have news articles and screenshots and images and documents and video footage of everything happening around us. Like, we're the front lines of information without all the Alex Jones criticism at this point. Maybe they will do that later. They'll call us all Alex Jones wannabes or something. But at this point, they can't prove us wrong. We have too much information. We're not playing scientists. We're not playing Q crap. None of that stuff. It's just information, and we're full of it. Hey, thank you so much, American 007, for joining the membership program, and welcome to the family. You're officially a hooligan. So thank you guys so much for being here. I will see you in an hour and 14 minutes with Jen Balsaki. We'll hear what enlightening stuff she has to say to us, and we'll have ourselves a good laugh. So thank you guys so much for being here. I appreciate all of you, and I will see you on the next live. Until then, stand tall, shine bright, and that's a wrap.